In fact, tons going on right now in Vigo County, from new mental health initiatives to special projects going around the county.
Well, Vigo County Commissioner Chris Switzer joins us live in the studio this morning to give us a Vigo County update. We want to start off with the news we received yesterday from Regional Hospital's parent company saying the hospital could close if the COPA is denied. This is what they had to say. If the COPA application is denied, the market conditions are such that HCA will need to seriously consider ending services or closing the hospital. Now, you say, Chris, that you support the acquisition, right?
Yeah, I mean, I've had the opportunity to be a part of these conversations for a little more than a year now. And understanding HCA's side and how difficult it is for a for-profit healthcare organization to make money in Vigo County is hard to understand, but you know, we have to take that with a grain of salt, and 1 in 4 Vigo County residents are on Medicaid or Medicare, so it is hard for an organization like that to make some money. So Union Health, being a nonprofit, they deal with a lot of those folks on that end of the healthcare spectrum, and you know, if it's not Regional Hospital, it's Union Hospital at the end of the day, and if that hospital license goes away, Union is the go-to organization here in the community.
Now, if they were to close their doors, say this is denied and Regional would have to close, what kind of impact do you think that would have on the community, especially all the people that work there?
Well, I mean, that's the biggest thing for me, and I know the mayor and my fellow commissioners, is there's 600 lives down there that will be affected by that closure, and they have to go work somewhere. And we'll always advocate for employees working here in Vigo County not having to travel outside the community, especially when you have such good programs at Indiana State University, St. Mary's, Ivy Tech, and Rose that specifically deal with that sector of healthcare, and we want those people to stay here, so we would hate to see that happen.
Yeah, for sure. Want to move on to mental health now? Let's move on. Okay, yeah, so you have started a new initiative to get people outside. You know, why is this an important issue?
Well, mental health is important in today's world. A lot of social media, a lot of just chatter from people, bullying, things of that nature takes a drastic toll on people's mental health, and especially with the workload in today's society and all the things floating around the world, I thought it would be a good idea to get out and talk about it. So started a mental health walk on Mondays at Dewey Point, West Terre Haute, where residents can come, have a conversation with me, my fellow commissioners, or any elected official that wants to show up. And we'll just take a 2-mile walk and get out and about and work on our health care, our health a little bit, and just enjoy a good conversation.
All right. So now the county has hired a firm on a different topic here to really help with infrastructure projects. One thing they're looking at is turning old community corrections into a treatment facility. How did that idea come about, and where are we in that process? Well,
about 6 years ago, Bill Watson, our Director of Community Corrections, came to the council and asked for additional funding to do a little bit more than what your typical community corrections does across the state. So today, if you get sentenced to community corrections, you're met with a nurse, and she goes through your chart, per se, and to look at what your history might be, and tries to find a way to get you insured, evaluates you medically, maybe gets you some type of medicinal help or something like that, and then you get put into the workforce. And we're seeing this program work tremendously in this community, and we would like to expand that. We're at 150 beds now. A new community corrections facility would be 250 beds, and we've already purchased 22 acres to the south of the Vigo County Jail to build that. Initially, we had a presentation planned last night for the county council for them to kind of stew on for the next month and ask questions. But with Senate Bill 1 happening and the financial forecast ever changing in the state of Indiana, we want to make sure we have those numbers correct before we present that to the council. So hopefully late June, early July, or potentially August, we'll have a request on the agenda.
And kind of sticking with, obviously, projects, construction projects and things, work obviously continuing down at the industrial park. You know, where do things kind of stand there now? Obviously, we've got Amazon, we've got Intech. Where are things happening?
Well, Amazon's up and firing. Okay. They're doing fantastic things, especially with contractors here in the community. Intech, we're still at a little bit of a standstill. We all know the political drama across the United States when it comes to Department of Energy funded projects between the Biden administration and the Trump administration. So with the state of Indiana working on behalf of Intech, Vigo County sending local letters of support to the DOE, And among several other things, we're hopeful that project will get fired back up soon. There was a lot of workers, not only from Vigo County, but all across the region working in Intech.
Yeah.
I know we just have a few more seconds, but I wanted you to clarify something because there's a lot of talk on social media right now about Hamilton Center and the funding and what the county should be doing. What is your view on that? I assume that you say that there are misunderstandings there.
Yeah, I mean, we don't have enough time to cover that today, David, but the most important thing to know is locally, Vigo County doesn't make that selection of who our community mental health center is. That's decided by the Family and Social Services Administration and the Department of Mental Health and Addiction. There's a state statute that requires the local municipality or county to fund their community mental health center. So no matter what our personal or opinions are of Hamilton Center, they're still our CMHC at the end of the day, and we need to work with them until something changes. So we look forward to continuing that conversation.
All right, and obviously so much more on that topic. We'll check back in with you soon to learn more.
Yeah, thank you so much for joining us this morning, Chris. We appreciate it.